Bismillahirrahmanirrahim. My affectionate students, Assalamu alaikum wa rahmatullah. Today I am going to discuss about some short notes of general pharmacology. And among these short notes, the points to be discussed will be tolerance, tachyphylaxis, addiction, VD, volume of distribution, therapeutic index, half-life, clearance, CPSS. I am going to discuss one by one. Tolerance. Tolerance, gradual diminution of response due to repeated administration of a drug is called tolerance. Once again, gradual diminution of response due to repeated administration of a drug is called tolerance. When the drug is used continuously, then the response will be gradually decreased. This is tolerance. Tolerance are of two types. One is congenital, one is acquired. Congenital tolerance, there is, for example, some animals can tolerate some drugs. For example, rabbit can tolerate atropine because in their plasma they contain enzyme atropinase which can destroy atropine. And acquired tolerance are of two types. One is pharmacokinetic tolerance, one is pharmacodynamic tolerance. Pharmacokinetic tolerance, the example is phenobarbital. Phenobarbital used once upon a time as sleeping pill. Phenobarbital, this drug is an enzyme inducer. This drug induces enzyme and increases metabolism of phenobarbital. So gradually response of phenobarbital, effect of phenobarbital will be decreased. This is due to increased metabolism. That's why it is called pharmacokinetic tolerance. It is also known as dispositional tolerance. Another one is pharmacodynamic tolerance. Here receptor sensitivity or receptor number or receptor interaction with drug is involved. And for example, morphine or diazepam, they will produce tolerance by interacting, by decreasing the sensitivity of the receptor. That's why it is called pharmacodynamic tolerance, concerned with dynamicity of the drug, involvement with down regulation of the receptors. Now, another term is tachyphylaxis. Tachyphylaxis is an acute type of tolerance. Tolerance is a chronic phenomenon, and tachyphylaxis is an acute phenomenon. Acute type of tolerance is known as tachyphylaxis. Indirectly acting drugs produce tachyphylaxis. For example, tyramine, ephedrine, they will enter into the adrenergic nerve, and they are entering into the nerve, they will cause release of the neurotransmitter from its storage site, from these granules, now vesicles, and the released will be exhausted, then there will be no effect. So this is acute type of tolerance. Example is tyramine, ephedrine, mostly indirectly acting drugs will produce tachyphylaxis. Now addiction. Addiction is a process of periodic or chronic intoxication produced by repeated administration of a drug, and is characterized by, number one, overpowering desire or intensive urge to procure the drug. Number two, tendency to increase the dose. Number three, physical and psychological dependence. Number four is detrimental effect to individual himself and to the society. And number five is abstinence syndrome or withdrawal syndrome if he or she is abstained from taking drugs. So this is collectively known as addiction. The characteristics: overpowering desire, then increased dose, tendency to increase the dose, then dependence, physical and mental, and also dependence, physical and mental, then detrimental effect to individual himself, and withdrawal syndrome. This is collectively known as addiction. So to develop addiction, there are some common features involved serially. There is habituation, then tolerance, then dependence, leading to addiction. Addiction is a global problem. Drugs having addiction liabilities are opioids, morphine, pethidine, benzodiazepines, phenobarbital, alcohol, cannabis indica, cocaine, marijuana. These are the addiction liabilities drugs. Addiction is a global problem. It is a problem not only our country, throughout the world. This problem is a burning problem, burning issue, addiction. And this, for the management of addiction, there are some antidotes, but antidotes play minimum role. For morphine, then we can use nalorphine, naloxone, or we can, later on, we can use methadone tablets, and also we can use propranolol or chloridine. Similarly, for alcohol, we can use metronidazole or propranolol. For benzodiazepines, we can use flumazenil, and for barbiturates, previously used bemigride, mezimide. But these drugs plays a very minor role. Most important role is find out the cause and try to eradicate. Then their counseling is very important, and psychotherapy and rehabilitation. This is very vital. Drug involvement, minor role played a minor role, but this psychotherapy, counseling, and rehabilitation is the main target to manage addiction. Now VD, that is volume of distribution, volume of fluid into which drug appears to distribute. This is VD. Actually, this is apparent VD, with apparent volume of distribution. Now, body fluid may be in plasma, in blood, in extracellular fluid, in intercellular fluid, total body fluid, and transcellular fluid. So, volume of fluid into which drug appears to distribute in a concentration equal to that in plasma is VD. The amount of fluid that would be required to contain all the drugs in the body in a concentration equal to that in plasma is VD. Evans blue, it is expressed in liter. Evans blue, its VD is 3 liter. That corresponds to plasma volume. Then heparin, its VD is 5 liter. That corresponds to blood. Then inulin, its VD is 15 liter, corresponds to extracellular water. Then antipyrine, its VD is 43 liter, corresponds to total body water. And chloroquine, it has got 13,000 liters. So we can imagine, is it possible that 13,000 liter in body? So it is an apparent volume of distribution. Now this is volume of distribution. Now the important factor is volume of distribution. VD may be high, VD may be low. We can get some information about high VD from high VD, and we can get information from low VD. If the VD is low, it means drug distribution is very limited, only in extracellular fluid, very limited, and the drug is mostly water soluble. This drug produces action quickly and quickly metabolized, quickly excreted. But if the VD is high, it means that this drug highly binds with tissue protein, and its T-half plasma T will be longer. It will produce slow and sustained action. And the important thing, those drugs having high VD, they are very difficult to be eluted by hemodialysis. So this is the hazards of drugs having high VD during hemodialysis. Now, therapeutic index. Before going to therapeutic index, I would like to say about half-life of the drug. Half-life means the time by which a measure will come to a half is called the half-life of that measure. Measure may be the concentration of drug in plasma, that is called plasma T-half. Measure may be the effect of drug in the body, that is known as biological effect half-life. And measure may be the excretion of drug from the body, that is called elimination half-life. For practical purpose, we use plasma T-half, that is, it indicates the action of the body as well as elimination of drug from the body. So the significance of half-life is to know the by knowing half-life we can have an idea about pharmacokinetics and pharmacodynamic parameters of that drug. Drugs having high therapeutic, high plasma T-half is longer. There are many drugs having long plasma T-half. As for example, digitoxin, amiodarone, then doxycycline, chloroquine, azithromycin, they have got long T-half. Long T-half, these drugs has got some benefit and these have got some demerit. Long T-half drugs, they are slow, their action is slow and sustained, and they are more binding drug. They will produce effect for prolonged period, and they will be less slowly metabolized. They will be extruded from the body slowly, and this is good for the chronic case. And here drug administration, frequency administration will be delayed, so patient's compliance will be good. But this is not good for acute cases, because in acute case this drug will not be act because its action will be delayed. On the other hand, there are some drugs having low plasma T-half, like catecholamines, like lidocaine. They have got short T-half, and short T-half, these drugs have got some benefit. It is suitable for acute emergency. It will produce immediate effect. It will be immediately metabolized. It will be extracted from the body quickly. And this drug, as it has got short half-life, they have to be repeated frequently. So the patient's compliance is poor. So this drug is good for acute emergency, but it is not good for chronic situation. So there is clearance. Volume of plasma cleared of drug per unit time is known as clearance. Clearance may be renal clearance, may be hepatic clearance. Clearance may be volume of plasma cleared of drug per unit time is clearance. Now, if it is said that clearance is 120 of a drug, 120 ml, it is expressed in volume per liter, volume by time. If it is said that 120 ml, if a drug having clearance of this drug is 120 ml per minute, means 120 ml of blood cleared of drug per unit time. 120 ml of drug, 120 ml of plasma cleared of that drug per unit time. This is the significance of clearance. Now there is a relationship between VD, therapeutic VD, and half-life and clearance. Half-life can be measured. Half-life is equal to 0.693 into volume of distribution divided by clearance. In this way we can calculate the, if VD is known, if clearance is known, then half-life can be easily calculated. Now the important thing is therapeutic index. Therapeutic index is the ratio between LD50 to ED50, or MLD means median lethal dose, or MED means median effective dose. Now dose is amount of drug that will produce desired effect. Amount of drug that will produce desired effect is known as dose. There are so many doses, like minimum effective dose, like maximum effective dose, like median effective dose. Median effective dose, maybe lethal dose, maybe fatal dose, maybe loading dose, maybe maintenance dose. Now, therapeutic, coming to against therapeutic index is the ratio between LD50 by ED50. LD50 means amount of drug that will produce lethal effect in 50% of the population of animal. And ED 50 means amount of drug that will produce desired effect in 50% of the population. So the ratio between effect LD50 or median LD divided by ED50 or MED is therapeutic index. Now, therapeutic index it must be more than 1. In clinical pharmacology, instead of lethal dose, we use TD50, means MTD, means toxic dose 50 to effective dose 50. One thing is important, that is LD50 will be in up and ED50 will be in down, or TD in clinical pharmacology TD50 will be up and ED50 will be at down. Now, lethal dose means fraction of the population will be killed by that dose of drug. LD may be 1, 2 LD may be 99. And 1 means one amount of drug that will produce 1% killing effect on 1% of animal. Amount of LD 90 means 90 amount of drug that will produce 90% killing effect in animal. LD 99 means amount of drug that will kill 99% of the animal. And if it is said that LD 100, then 10% animal will be killed by that dose of drug. So when there is LD 100, it is not termed as LD 100. It will be denoted as a fatal dose. Fatal dose means 10% animal will be killed by that dose of drug. So LD, it starts from 1 to 99, and when there is 10%, that will be fatal dose. And therapeutic index is the ratio between toxic dose in clinical pharmacology, TD50 by ED50. TD50 means toxic dose 50. And ratio must be more than 1. Ratio 1 in case of potassium cyanide means in case of potassium cyanide, LD50 action starts at dose and the action is death. That's why it is a poison. Though it is a drug, but it is a poison. So therapeutic index must be more than 1. There are some, and it indicates the safety margin of a drug. And this safety margin is not absolute value, it is relative value, relative safety margin of a drug. Now, because if a drug has several effects, for example, aspirin, it has got, in very low dose, it has got antiplatelet effect or antithrombotic effect. That is, in 75 milligram, it has got antiplatelet or antithrombotic effect. A bit higher dose, it will have antipyretic effect. A bit higher dose, it will have analgesic effect. A bit higher dose, it will have anti-inflammatory effect. A bit higher dose, it has anti-uricosuric effect. So there are so many effects of the same drug, but and each drug has each effect has got individual therapeutic index. Say for anti-inflammatory effect and for uricosuric effect, its therapeutic is very low. It is close to its toxic effect, but it is relatively safer when we use as antiplatelet effect. So it gives a relative value, relative safety margin. On the other hand, benzodiazepines, when it is in low dose, it will produce anxiolytic or tensiolytic effect. A bit higher dose, it will produce hypnotic effect. A bit higher dose, it will produce anticonvulsant effect or anti-epileptic effect or muscle relaxant effect. A bit higher dose, it will produce an anesthetic effect. So each effect has got its own therapeutic index, and that's why an anesthetic dose, a bit higher dose also produce anesthetic effect. But these drugs having low therapeutic index, anesthetic effect, anticonvulsant effect, anti-epileptic effect, these effects have got low therapeutic index. But relatively better is anxiolytic effect or hypnotic effect. So the effects of same drug having different pharmacological effect is having different therapeutic index. So it gives a relative value, not absolute value, of relative safety margin of a drug. Now one thing is CPSS, steady state plasma concentration, steady state plasma concentration. That is, here if a drug is given repeated continuously or intermittently, initially concentration built up in the body, and later on drug excision begins, and ultimately a time will come when there will be a stable or plateau state will be achieved in plasma. This plateau state is known as CPSS, steady state plasma concentration. At this level, it takes usually 5 half times to achieve plateau level. And when at this plateau level, the amount of drug that will be excreted, if we supply that drug, then drug can maintain its normal beneficial activity. So when a plateau state is achieved, then the input and output will be equal, and if we just supply the amount that is excreted from the body, then the drug will maintain its beneficial activity, and this dose is known as maintenance dose. There is also loading dose, which are nowadays maximum case in majority of the cases, especially the antimicrobials, loading dose is used. Loading dose means more than 2 or 3 times greater than average dose, therapeutic dose. And this is especially for chloroquine. These drugs having high binding capacity, then loading dose is used. Azithromycin, we use loading dose because these drugs must satisfy the binding site. Digitoxin, this drug must satisfy the binding sites first. After fulfill of the binding site, then drug comes to free fall, and then it will produce its activity. So this CPSS, when achieved, we just give the amount excreted from the body, and that is maintenance dose, and that will maintain the beneficial activity of the drug. Now there are 2 types of kinetics that body will follow. One is first order kinetics and one is zero order kinetics. For absorption, for metabolism, for excretion, these 2 kinetics is effective. Is effective. The most common kinetics is first order kinetics. Here it follows loss of mass action. The excretion of drug from the body is directly proportional to the concentration of drug. If the drug amount is more, then excretion will be more. If the drug amount is less, excretion will be less. It follows loss of mass action. Because and here half-life will be constant, and a constant fraction of the drug will be eliminated per unit time. Most of the drugs in the body follows first order kinetics because drug body is harbor of enzymes, and drug which is supplied from the outside, its amount is less. That's why always drug enzyme always metabolizes in a constant rate. That means a constant fraction will be eliminated per unit time, and half-life will remain same. So large amount of drug will not produce excessive toxic effect. But there are few drugs like phenytoin, like salicylates, like theophylline. Their situation is different. Here, if the amount of drug, certain amount of increase in drug will produce a severe toxic effect, because these drugs, metabolizing enzyme is not enough. That's why the amount will be constant amount of the drug will be limited per unit time. Here half-life will be increased. and drug will produce increased toxic effect if there is slight increase in the drug. And so this drug will again follow first order kinetics when the amount of drug will be decreased and the amount of enzyme will be increased. Then it will follow first order kinetics. So these are the kinetics that is played role in our body. Now, from this therapeutic index, there are some drugs having high examples of high drugs having high therapeutic index are atropine, then penicillin G, then antihistamines, H1 blocker as well as H2 blocker, then antacids, then paracetamol. They have got high therapeutic index. On the other hand, drugs having low therapeutic index are anti-cancer drug and drugs interfering central nervous system like anti-epileptic drug, like general anesthetics, then antipsychotic drugs, then anti-arrhythmic drug, then anti-cardiac glycosides, aminoglycosides. They have got low therapeutic index. So from this chapter, the important things is to know the definitions and some descriptions of each, because it is very important for SAQ. It is also important for Viva. And drugs having addiction liabilities, one must know that opioids, morphine, then heroin, pethidine, codeine, then alcohol, cannabis indica. Cannabis indica is common in our country, and alcohol is very also common. And many friends are indulged to alcohol, and we can revert them by using metronidazole, and this is called, and this metronidazole will interfere the metabolism of alcohol, and there will be increased level of dehydrogenase, level of aldehyde, and it is very toxic, and the patient may be unbearable symptoms will feel by the patient if he does not know that this drink contains metronidazole, and this way ultimately he will keep aloof from taking alcohol. So this is also known as aversion therapy. So addiction is a problem, and we have to say no, and with this we have to advise not to be indulged with these drugs. Thank you for your patient hearing. Assalamu alaikum wa rahmatullah.